Hello, thank you for joining me. My name is Anil Taylor. I'm a consultant gynecologist and I practice in the UK. In this video, I want to talk about the human papilloma virus, the HPV virus, and say a little bit about vaccines, the HPV vaccine. So I have created some other videos, especially on cervical cancer and pre-cancer. Please search them out because they will help you to understand what I say in this video as well. So the ones that are most relevant are the ones where I'm discussing why women should be having regular cervical smears, and another video on what abnormal smears mean. So please have a look at them. So on the HPV virus front, so the HPV virus, it's what we call a DNA virus. It's a fairly biggish virus, so it has an envelope which is created by the virus, and consists of proteins called the L proteins or the late proteins, using those proteins, it creates an envelope, and that's the virus particle. Within that envelope is contained the DNA, and the DNA codes for genes, and roughly speaking, there are 3 types of genes that it codes for. So it codes for the E proteins, which are the early proteins, meaning once the virus has infected a cell, it's these early genes that start doing the virus's work, and then towards the end, the L proteins, the late proteins, come into action. So the early proteins help to replicate the DNA in the infected cell, and the L proteins help to create the surface envelope. Now there is the E6 and E7 proteins or genes that are especially important, especially for the high-risk HPV types, which I'll mention in the next few slides. So they help to transform the infected cell into precancerous cells. So we'll talk a little bit more about that in the next few slides. So HPV, there are many, many different types and subtypes of HPV, more than 150 types. And they're each given a number. And they're broadly categorized into 2 types, the low-risk type or the high-risk type. So the difference between the low-risk type and the high-risk type is the fact that the low-risk type are ones that don't really have a significant potential to transform the cells into cancerous cells. So they may cause mild precancer, but rarely, if ever, will progress all the way up to cancer. The high-risk types of HPV, on the other hand, do have that potential to go all the way through the precancer range and then into the cancer range. So it's the high-risk HPV that we are most interested in picking up and treating. So the examples of the high-risk type, the 16 and 18 are the most common types, and they account for about 70% of all cervical cancers. Now, what this chart shows is that, of course, there are other types that are also important in the causing cervical cancers. So they are the types 31, 45, 33, 52, 58. And once again, we'll come back to these subtypes when we are talking about the vaccine. But these 7 types account for approximately 90% of all cervical cancers. Now, how common is HPV amongst women? So when we are talking about both low risk and high risk HPV types. What this chart shows is that roughly about 60% of women at the age of about 20 will have been exposed to some form of HPV virus. And yes, over the years, the immune system will clear it, but by the age of 45, there will still be about 10 to 15% of women who will still have some form of HPV, either low risk or high risk type. So it is a very common virus. And so what symptoms does it cause? And the answer to that is none. HPV infection does not cause any significant symptoms, meaning it does not cause any discharge or any pain or any bleeding. It is more or less a silent infection. And so when you are infected with that HPV virus, most women, say 90% of women, will clear the infection within the next 1 or 2 years. And the ones that don't, it's again that E6, E7 protein, the ones that help to transform the cells into precancerous cells. So they come into play, and that's why they're important. And once again, we'll say a little bit more when we talk about vaccines. So cervical precancers, or the thing that HPV causes, can be either low grade or high grade. So the low grade is a borderline or a mild abnormality, and certainly the low risk type can cause these abnormalities and rarely progress to the high grade phase. It's the high risk HPV that can progress from low grade to high grade and even beyond into cancer if nothing is done. And so the HPV is detected on the smear itself. So the smear that women have, the cells that are collected, they are deposited in a fluid, and the fluid is examined by the lab, and they are able to detect the HPV virus, and they are able to type it. So what that means is that the lab is mostly interested in the high-risk type. If they find the low-risk HPV, they will consider the smear as being normal, even if there is HPV. If it is a low-risk HPV, the smear will be called normal. So it will only be called abnormal smear or a positive smear if there is high-risk HPV detected. And one of the questions that women ask when they are referred with an abnormal smear is if they have got an HPV, should their partner receive treatment to clear the HPV? Now, the answer to that is broadly no. Yes, HPV in men can cause cancers such as penile cancers or oropharyngeal cancers, meaning mouth cancers, throat cancers. But on the whole, the penile cancers are quite rare, much rarer than cervical cancers, roughly about 4 to 5 times rarer than cervical cancers. So it's not necessarily a big problem in men. If we now move on to the vaccines, we can talk about, broadly speaking, 2 types. So the commonest type, which is what everybody knows about, is the vaccine that prevents infection with HPV. That's what came out about 10, 15 years ago, and that's the one that young girls from the age of 9 are vaccinated against. So we'll look at the data to see how effective it is in the next few slides. The other type of vaccine, which is not known about, because it is very much experimental, but it certainly does show a lot of promise, and that is the type of vaccine that is hopefully going to help us try and clear persistent HPV infection, diseases related to persistent HPV. So things like cervical precancer, vulval precancer, vaginal precancer, or anal precancer, amongst others. And so the way these two vaccines can be differentiated is, so the first type, the ones that we are already using, are the ones that immunize against the surface protein. If you remember, we talked about the L proteins, which make up the surface envelope, and that protein is the one that the current vaccines immunize against. So the ones that are still in the experimental phase, the vaccines, are the ones that are going to target the E6 and E7 proteins. If you remember, these are the proteins that help to transform the infected cell into a precancerous cell. So this is very much experimental, and trials are still in progress. And hopefully, in the next few years, we will see these types of vaccines coming into existence. So when the vaccines first came out, about 10-15 years ago, there were the two types, the Cervarix and the Gardasil. The Cervarix vaccinated against type 16 and 18. If you remember, those are the ones, the high-risk HPV that cause about 70% of cervical cancer. So it only protected against the HPV that cause cancers. Gardasil, when that vaccine came out, roughly at the same time, in addition to 16 and 18, it also included protection against types 6 and 11. Now, roughly speaking, 6 and 11 are low-risk types, but they cause the majority of genital warts. So the rationale behind including those two was to try and minimize the problem created by genital warts. And again, we will look at some of the data. Now, more recently, Gardasil have now brought out the Gardasil 9, which now includes, in addition to the 4 before, now it includes the 31, 33, 45, 52, and 58. Now, if you remember earlier, in my earlier slide, I showed that those 7 high-risk types account for about 90% of cervical cancers. So the Gardasil 9 is now hoping to cover most of those viruses. So who gets the HPV vaccine? Now, the initial studies were done on individuals beyond the age of 9 up to the age of 26. So it can safely be used in that category. And at the moment, they certainly are used to vaccinate women or girls after the age of 9. Usually that happens at the school. So those are the individuals who are receiving the large proportion of vaccines. How effective is this HPV vaccine? So when the vaccine was introduced about 10-15 years ago, the data that it was based on was fairly convincing. So here you can see that when comparing women who had the placebo vaccine compared to the real vaccine, and looking at roughly about 8,000 women in each group, the high-grade precancers or cancers, they were prevented or went down from 53 down to 0, which is very impressive. And with Gardasil, who included the protection against the genital warts, once again, it was fairly impressive protection. So it went down from 91 out of roughly 8,000 to 1 in roughly 8,000. So that is very, very good protection against genital warts and indeed high-grade precancer and cancer. So that was what was so convincing about the vaccine and why it is now very much in use. So the question can be asked, if the vaccine is so effective, should these women still continue to have regular smears? And the answer to that is very much a big, big yes. These women should continue having regular smears. At least that is the current advice. There is some data coming out that is seeming to suggest that these women who have previously been vaccinated may require fewer smears in their lifetime, but they still need to continue for the time being having their smears either 3 yearly or 5 yearly. Now, if somebody has previously been infected with HPV or has actually had an abnormal smear with abnormal precancer cells, can they have this HPV vaccine? And the answer to that is yes, they can have this vaccine. And that is because most women who have previously been infected or had precancer cells will not have been infected against all those HPVs types that the vaccines protect against. So therefore, these women can, if they wanted to, they can have the HPV vaccine. And that is all I want to say on this subject. Thank you very much for listening. I have many other videos that I have uploaded on a similar topic. Please search them out, and if you find these videos helpful, then please consider subscribing or clicking the like button. Thank you very much, and until next time, please stay safe.